we take a look into the new medical oncology space and hear from the lead caregivers.
Roswell Park is an NCI, National Cancer Institute designated organization. They are a nationally ranked organization, U.S. News and World Reports 2021 through 2022, and now we have that here in the Capital Region.
The Roswell Park is the premier cancer center. To be able to offer it to patients closer to home, I think that's really beneficial to the patients of this area. It's a specialty. We focus on oncology, and yet we focus on the patient as a whole. We really see and treat the whole patient.
Receiving a cancer diagnosis is overwhelming and very devastating. When they come to Ellis Medicine, what they can expect from us is 100% assistance, comprehensive care, and us doing the work for them. Their job is to heal, and our job is to do the rest for them.
We work closely with Roswell. We are basically like a satellite of them. And then we hope to be able to bring all of those clinical trials and use their infrastructure and their experience and to be able to offer that to the patients right here.
Cancer support can be as healing as the treatment itself. Understanding what is our patient looking for, what are their family members looking for in their treatment, and are we reaching those goals for the patient? The new Ellis Roswell team members are an incredible team.
The therapists, and you need a financial counselor, if you need social work, if you need psychological counselor, if you need a physical therapist.
Access to Roswell Park, specialized physicians, telemedicine to provide almost immediate consultation with another specialist in a certain area. It really brings those cutting edge treatments to our community in a community setting. We want you to feel like you can tell us what you need and it's already done for you. You can stay home, but have that same level of care provided to you right here in the comfort of your own home and the comfort of your own community hospital.
Wow, what a beautiful space, and how fortunate we are to have this level of care right here in our backyard. So let's start with Dr. Schwab to talk about Roswell Park. Welcome, Dr. Schwab.
Good afternoon. Greetings from sunny Buffalo in Western New York to hopefully equally sunny Schenectady in the Capital Region. Roswell is actually the nation's very first cancer center, founded in 1898 by Dr. Roswell Park. We do have a little park, but that park is called the Kaminsky Park. The thing that makes Roswell Park special is that Roswell Park's vision was to be able to provide bench-to-bedside research to as many New York State residents as possible. So we're actually a New York State entity, and we are very mission-driven. And our goal is to provide as much high-quality cancer care to as many New York State residents as possible, including in residents in Schenectady. To be an NCI designated comprehensive cancer center means that there's actually a very, very small number of such cancer centers in the country. Just about 40 or so of those exist in the country. And the vision originally was that, and by the way, Roswell is one of the 3 founding cancer centers of the NCI back in the 1950s, I believe. Every 5 years, we have to jump through a bunch of hoops to get our comprehensive cancer center designation renewed. And with that, we are being judged not only by our clinical expertise and experience, but also by our research experience. And so that holds us accountable to a set of standards that are par none in all of New York State. We are the only NCI designated comprehensive cancer center in upstate New York, outside of the cancer centers in New York City. The goal of if you could move on to the one of the next slides that communicates the Roswell Park Care Network. Let me just quickly talk about research. So the one thing that makes Roswell special is that we truly have what's called bench to bedside research, where where a researcher like me will come up with a phenomenal idea and say, hey, listen, let me come up with a bunch of experiments that may create the foundation for the scientific idea that I may have. And then we write a protocol that gets obviously IRB approved and is supervised by all the regulatory agencies. But then we can literally take that research protocol to the bedside for the patients that walk through our doors. And we'd love to be able to introduce that level of cutting edge cancer care to our patients in Schenectady. If you move on to the next slide, that slide actually communicates that the Roswell Park Care Network by now spans all of New York State, all the way from Western New York to Long Island. And the overall goal is that a patient walks into one of our affiliate sites and has access to everything that makes Roswell special. And that, by the way, spans the entire cancer continuum from cancer prevention, cancer screening, cancer diagnosis, cancer treatment, to then what we call survivorship, and maybe even palliative care and end-of-life care for patients that are suffering from cancer. Modern oncology care is a highly coordinated care delivery model. In the past, we would accept that a patient would go for weeks between seeing the different specialists, between a medical oncologist, a radiation doctor, and a surgeon. Modern cancer care by now recognizes that all of that has to be tightly coordinated, and that's what Dr. Mahmoud will be able to do right there at Ellis Hospital in Schenectady. She will be able to have access to some of the super subspecialized physicians at Roswell Park through telemedicine. So for instance, if she has a complex kidney cancer patient, rather than that poor patient getting in the car driving for 4 hours to Buffalo, and then Dr. Schwab reviews the scans and says, you're not a surgical candidate, that patient can have that type of conversation right then and there in the safety of their community hospital in Dr. Mahmoud's office. And that patient will have access to my expertise. So that's really what this relationship is all about.
Thank you, Dr. Schwab. As a reminder, we welcome any questions for our experts. Please use the Q&A box below. And now we'll introduce you and hear from Dr. Mahmoud.
Can you put up my first slide? So what it means to be a NCI designated cancer center is that it has been in numerous studies shown to improve long-term survival rates. Almost triple survival rates as opposed to patients who are treated in other settings. Okay, next slide. So with this affiliation creating a Roswell Park site at Ellis, what we hope to accomplish is the same high survival rates and the same level of care that's being provided at Roswell Park in Buffalo. We are able to access Roswell's care plans that have been developed, and the same culture that pervades Roswell Park, we would like to emulate here, and that's of quality and compassion and attentiveness to each individual. We aim to get patients in quickly and also provide second opinions on patients' care plans and send them back to their oncologist or continue care here if they should so choose. We're able to, like Dr. Schwab mentioned, virtually do consults with the Roswell Care team if we feel that that's necessary. I'm a general oncologist, and in Roswell, they subspecialize into, like Dr. Schwab does surgery of the genitourinary tract. So if I'm not sure if somebody is a surgical candidate or not, I can get a consult with one of the doctors out there in the comfort of them being in their own community. In addition, I am able to discuss patients not only in our local tumor board here at Ellis, but also consult with the oncologists out at Roswell and put patients on their tumor board for us to discuss the patient's care. Next slide, please. So the next phase of our program is that now we are open for consults and second opinions, and we're seeing patients, giving chemotherapy, but we would like to develop a survivorship program, a clinical research program, and then our first focus will be on developing a breast cancer program. So I look forward to working with this community and getting these things going.
Great, thank you, Dr. Mahmoud. Our community is thrilled to have you here providing care at Ellis. So we thank you for that. Now let's turn this over to Dr. Nancy Sapio.
Hi, good afternoon, everyone. Pleased to see you all here. I've been with the Family Health Center, which is a residency training program. We've got 30 doctors, and it's part of their training that they spend 3 years of residency here. They get a lot of cancer exposure from their patients that we see. I myself, having been here, this is my 36th year. I actually did my residency here, and I've just never left. I feel I have an important knowledge of not only the residency, but also cancer, as I myself am a breast cancer survivor. And that comes in very handy. No one wants to join the cancer club, but you don't really have a choice. As a primary care doctor, it's really essential. I think it starts with us. Cancer doesn't come into the picture until you're told. But the primary care doctor, we're a team player. You and I are on a team together, and we're going to work together. Probably the most important thing is that it's an education. I'm teaching you. You're also teaching me. There's always a two-way street here. I think that once you get that diagnosis of cancer, we more or less turn over the care to the oncologists, because they're the main players. We're always going to be in the background. But my own journey with cancer, I felt like when I saw the pathology report that I was in a movie, and it wasn't something that I was suspecting at all. But got through it, just as many of our patients do, at least the majority that I've seen. But your primary care doctor, we're gonna first, you meet us, we're gonna do a history and physical. And it's gonna be pretty much what's routinely. We're gonna basically go through what's bothering you, and we're gonna go through a review of systems. Then we're gonna ask your medicines. We're gonna ask about family history, which is really, really important. We're gonna ask about social history, your occupation. And then we're gonna go through all of your medicines. Sometimes medicines are important to know, because they may also be risk factors for other cancers. May order some labs, may order ultrasound scans, mammograms, head CTs, pap smears, DEXA scans, all of these things. Primary care is very, very big on preventive medicine. That's our job. We're supposed to educate you. We're trying to prevent you from any of the I guess, diseases that are there, not just cancer, but everything else. Once you do get that diagnosis of cancer, we're going to step in the background, but we're always there. Your oncologist is the most important, but we are now then coordinators of your care. We're going to make sure that your cancer doctor knows what your cardiologist is saying, or what your pulmonologist or any other specialist doctor that you have. It's so very important that somebody is coordinating the care, because one doctor may not know what the other doctor is doing. In addition to us, we have our nurse managers and things that you may need help with, whether it's transportation or durable goods, getting a shower chair, getting a wheelchair, getting whatever it is that you need. We can help with that. Oxygen, physical therapy, all of these things. But for me, the most important thing is that we educate you, and you can educate us along in the process as well. Some of the things when I talk about the specialists, where nutrition isn't taught very much in med school. It's getting better, but it's still not. So this is an area that we're going to spend time. Nutrition, all of this you've heard before. Nutrition, diet, exercise, making sure you see your dentist, making sure you see your eye doctor, and if necessary, physical therapy. Basically, cancer is caused by a combination of factors that involve smoking, genetic mutations, hormone, immunizations, diet, and infectious disease. That's not necessarily, excuse me, that immunizations. 90 to 95% of deadly cancers are due to environmental and lifestyle factors. It's extremely important that we be diligent about screening and letting you know. Pretty much, diligent screening probably tops avoiding cancer, avoiding tobacco, increased heavy alcohol use, obesity, low activity levels. These are things that are going to increase your risk. Some of the things that decrease your risk, I can't say over and over again, see your doctors, stop the smoking. Overall, with all cancers, and I'm going to try to see if I can squeeze in at least the top 3. Overall cancers, you may experience one or many of these symptoms, where fatigue, weight loss, loss of appetite, nausea, vomiting. You might notice a change in your color or the size or shape of your stool. You may have more diarrhea, may have more constipation, you may have a combination of both. Things that we worry about, all of a sudden, if you have a bone fracture, where did that happen? And it's unexplained. You have no reason as to, why all of a sudden you may have a fracture in your back. All of a sudden you got severe back pain. It's our job to look and find out. Blood clots. Every time somebody has a blood clot, we need to know why did that blood clot? What risk factor did you have? What's with the blood clot? We need to figure that out. Night sweats is another important information to let your doctor know. It's really important that you tell us as much as what you're feeling. Don't be afraid to tell us. I know myself as a physician, I'm tired all the time. I don't know about the other doctors out there, but I think that they can attest to the fact that, yeah, we're tired, and you get used to being tired. When they said, didn't you know, didn't you feel it? And it's like, no, I really didn't. And I'll get more to that too. But let me talk about the 3 top cancers. We have lung, breast, colon, and rectum. Lung cancers, some of the symptoms that you're going to notice is you may feel shortness of breath. You may have an unexplained cough. It doesn't go away. You might find wheezes. You might be spitting up blood. You might feel hoarse. Again, fatigue. What are some of the risk factors? If you've got a positive family history, if you're a tobacco smoker, if you have a poor diet, if you get frequent lung infections, secondhand smoke is something also that people shouldn't, my father was a constant smoker growing up. I don't smoke at all. No one in my family smoked. The girls, excuse me, or my brother did. But secondhand smoke is something that we will inquire about. What is the decrease your risk? tobacco, again, tobacco. You'll find a lot of the same things in the three that I talk about, where it's, tobacco, increase your activity. Don't be sluggish. Don't just sit around. You need to be active. Other things that are important is, probably the most important thing is doing your yearly physical exam with your doctor. One of my best friends is an oncologist, and I've had patients diagnosed with lung cancer that said, I don't smoke. How did I get this? Secondhand smoke, but the more common cause, and I don't know why we don't talk about it enough, but radon. I tell our patients, you should have a radon detector in your cellar. It's not that expensive. It's about $10. But you set it up, it takes like 2 days, you mail it, and then they give you the results. To me, I don't know why we don't stress that more, but that's one of the things that I will talk about. The secondhand smoke, again, another area. Breast cancer, near and dear to me, as I lived through the journey and came out on the other end. But symptoms of breast cancer, changes in the size or the shapes of your breasts. Normally, most women's breasts they're not equal. I don't know the perfect breast. I don't know if that exists unless it's basically implants. But one breast is going to be larger than the other. But you need to look at your breasts. You need to look and see, is there any difference? Is my nipple, is it look funny? Is it retracting? Like not sticking out as much as it should. You should never really be squeezing your nipples, but sometimes people will say, well, it looked like there was blood, so I squeezed it, or there was white stuff. That's something important you got to tell your doctor about. You shouldn't be having nipple discharge unless, you're breastfeeding or you have another health concern. And if you do, that's our job to help find it out. Any kind of thickening of the skin on your breasts, any redness, tenderness, pain, dimpling of the breasts. It's funny because they don't really promote breast exams anymore the way they used to. However, I am a big advocate of doing the breast self-exam. I found my own breast cancer just doing my monthly breast exam. And it's really important that women out there, that they know and are familiar with how their breasts feel, especially if you're premenopausal, before and after your period, and certainly postmenopausal, because that's when breast cancer tends to hit older women. You may notice that you may have pain in your armpit. Why you may feel a lump in your armpit. Those are all important things. You may notice that for some reason your arm is swelling or your legs may be swelling. These are all important things. What are some of the risk factors for breast cancer? Again, family history. The more exposure to estrogen that you have, if you got your periods really early and your menopause very late, that means you had a lot of exposure to estrogen, which is a very high, excessive estrogen, high risk factor for breast cancer. If you've had increased estrogen exposure, did you take fertility drugs? Were you on birth control pills? Fibrocystic breasts, those lumpy breasts that you feel that are tender just before your period, that will put you at risk. Some of the things that can decrease the risk, having children. Wow, that's great. At least for those of us that wanted it. Doing your mammogram. If your mammogram, you're due for it or you're in the right age group, I still would promote breast self-exam. I think that's important. Diet, exercise, obesity is a high risk factor for it. All of these things are important. Moving on, because I could probably talk about breast cancer this whole forum. But moving on, we'll talk about the third one, colon and rectum. Some of the symptoms that you have there, you may notice again the change in your bowel habits. You may have more constipation. Diarrhea is more common. Sometimes pencil stools, when your stools come out and they're really skinny. The color of the stool. I know as doctors, we gross our patients out. Well, what did it look like? And they're like, I don't look, I just flush the toilet. And it's like, no, look, you know, you should look. Sometimes they find it like, well, I wiped, I found it on the tissue. You should look at your stools, you know, get an idea. Rectal bleeding is common, nausea, vomiting, loss of appetite, weight loss, again, fatigue, if you're anemic, if you feel short of breath. All of these things. If you have some of what's called the Crohn's disease or ulcerative colitis, the inflammatory bowel diseases, if you have those, especially ulcerative colitis, that will put you at a much higher risk of getting colon cancer, and it usually does come within a 10-year period. It's essentially, you can't, it's not something that you can ignore. Breast cancer, even when you, getting back to breast cancer, I forgot to mention this too. When you have breast cancer, after you're all said and done, after you've done the chemotherapy, if you need to, after you've done the lumpectomy, chemotherapy, radiation, all of that's done, I find a lot of doctors don't recommend that their patients get their ovaries taken out. I've met, they're older women, they're getting better as they get younger, but it's important to talk to your doctor. You should have your ovaries removed. When you have breast cancer, it puts you at a higher risk for ovarian cancers as well. So I neglected to mention that. Again, let me go back to the colon rectum. I got off topic there, but some of the increased risks there, if you're drinking a lot, that actually with women too, breast cancer, you're really only supposed to have one alcoholic drink a day, if that at all. I mean, best is not to have any, but I'm not sure how many people do that. But if you're a smoker, if you have any of like irritable bowel disease, where the difference being alternating diarrhea, constipation, polyps, if you've had your colonoscopy and the GI doctor says you have a polyp, I'll see you back in 3 to 5 years, that's another reason for concern. They changed the guidelines for colonoscopy. It used to be at 50. You should start getting it at age 45. And you know, you don't have to wait to 50 anymore. And you don't have to be as fearful as some of the stories that are out there, drinking the huge gallon or whatever, Go Lightly. They have much easier preparations with Miralax, Ducalax. I mean, it's, and you don't have to drink quite as much of the things. But the colonoscopy has made a big difference, and oncologists could talk more about how detection of colon cancer, having done the colonoscopies. And I think that's why they lowered the age. Risk factors, again, to decrease the risk. Do your colonoscopy, have a high fiber diet. The people that tend to have colonoscopy, or excuse me, colon cancer, their diets wasn't high in fiber. And what do we tell everybody? Again, the nutrition, we need to eat more fruits and vegetables. When you look at your plate should have 2/3 of it, basically, with the fruits and vegetables. Let me just see much. I could go on much more. I mean, there's cervical, ovarian, and a bunch of different cancers, but I also know that you may have questions. Go to your family doc. They do know, and especially our residents, I'm very proud of our residents. They do know how to handle what to do next, and especially preventive medicine. Thank you.
Well, thank you, Dr. Sapio. I mean, you touched on a lot of different subjects and topics that we all really experience in our day-to-day lives, and that we might not think of or realize the long-term effects. So I think it's important to kind of bring it back to for us to realize and think about. We bring it to some of our questions here. Our first one is, do you have to be a New York resident to participate with Roswell Park?
I can take that answer, Brooke, for you. So no, you do not. We do accept most nationally recognized insurance companies or payers, which is what we call them. You can access a full list of our participating insurances by accessing our website at roswellpark.org. And then you just scroll down a bit and you'll see a nice young lady there, and it'll say, "Am I covered?" You just click on that button. and it'll provide you with a list of our participating insurance companies.
That's good. Just our next question here is, how long does it take to get an appointment? Where do I call? Do I call Buffalo or call locally? Is there a place where we can send our viewers?
I can take that as well. So you can do one of two ways. So one is by accessing the website. It's roswell@ellis.com. So that's Roswell with 2 L's at ellis.com. And you'll see right on the home screen, there's an orange button that says request an appointment. You can access the appointment folks that way, or and get pen and paper handy. You can also call the office by dialing 518-243-4762, and I'll put that number on the chat. Oh, and I see it there, yeah. Great.
Thanks. So what is survivorship? What's included? When does it start? Is it just for the patient or his or her spouse, family?
That's a great question. Survivorship starts for the patient as soon as they've been treated. For many cancers, they may have lasting side effects. So survivorship manage part of those lasting side effects. The other piece to it is that you may require lifelong surveillance or monitoring of certain symptoms, and survivorship plays a role into that. You may not need to see the specialized cancer doctor for that, but that could be coordinated tightly with your family doctor at home. And obviously, cancer doesn't just touch the patient, but also touches the family. So survivorship also includes, the entire kind of social network for the patient as well.
This is Marcy. I know survivorship is one of Dr. Mahmoud's most favorite things. She and I have had some wonderful conversations about it. If you want to know more about survivorship in the Roswell model, if you go on the Roswell Park website, and at the top bar it has survivorship. Those are some of the things that are rolled into survivorship, and I know Dr. Mahmoud's vision is to do that type of family support, patient support locally, things like nutrition and physical therapy. How do you get folks connected with maybe a yoga class for cancer survivors or for folks going through cancer treatment? I know, Dr. Mahmoud, can you kind of share some of your vision for that, which I know is very exciting?
So I look at survivorship as, people go through chemotherapy, and we put people through chemotherapy with the hope that everybody's going to be a survivor. But we also recognize that a lot of these therapies take a significant toll on the patient and the family. So what I'd like to do is a global, something that encompasses the whole patient. So not only the symptoms, and like Marcy said, the physical therapy, nutrition, counseling, whatever it needs to get you back to your usual functional state. And to live as long as possible, as well as possible.
Can I add my 2 cents to that, into that? As a survivor, I do remember after my treatment, they said, "You're a survivor." And I remember thinking, what? What if I survived? And it actually was, I turned around and, over time, I understood where you were coming from. But yeah, having gone through the chemo, I actually thought to myself, because the chemo is so difficult on the GI system, and the chemo left me with neuropathy, which tingling hands and feet and pain. But more importantly, when I was going through the treatment, I remember thinking to myself, if the breast cancer doesn't kill me, I'm going to die of esophagitis or gastritis or stomach cancer, because the GI symptoms were, at least for me personally, were just so awful. And if I had lost weight with the diagnosis, or prior to the diagnosis, I lost a lot more weight with it, with the chemo. And I think that's something that when I have my patients, I really explain that. And I say, let's get you on a PPI, a proton pump inhibitor. Let's protect your gut to make sure that, this you suffer less. Just get the Carafate, just get everything on board. So.
If I could just jump in again, we've had through the foundation, and I know many of you on the Zoom today are doing this with through Women's Night Out, and you're all friends and supporters here at Ellis Medicine. And one of the pieces that excites the foundation and so many of you is this whole concept of survivorship. So I know through Dr. Mahmoud's leadership and Dr. Schwab, we have been in contact with the folks at Roswell who do this, who lead this, and one of our great things moving forward is to put together a comprehensive survivorship program. Because the one thing I have been so impressed with the folks at Roswell, with Dr. Schwab, with David, and with Dr. Mahmoud, that they are committed to cancer, but they're committed to life. And survivorship is about life. And that's what makes this exciting. And that's what makes this transformative for our community and for our region. So anyway, so stay tuned from the foundation end, because at some point we might be calling upon many of you to partner with us as we put the survivorship program together. So enough from me. Brooke, keep going with the questions. I think you've got some good ones in there.
Yeah, we do. We have a lot coming in, which is great. A question for Dr. Schwab. Has there been an increase in people getting colon cancer at a younger age? What trends are you seeing?
Well, that's a great question, but you're asking the board certified urologist, so I'm not even going to go out on a limb here to answer that question. But the point of this partnership is that your viewers and whoever has that question can access the Roswell Park website and can ask exactly that question right there.
But we are seeing younger and younger patients being diagnosed with colon cancer. And, maybe it has to do with diabetes and the obesity epidemic. I don't know, but we do see, and that's one of the reasons why the guidelines have changed.
Another question that's coming in. Are there any new breast cancer treatments being researched, trialed, or used?
Again, the short answer is yes. And breast cancer is not one disease. So you have to look at the specific type of breast cancer, and there are many new treatments and trials.
Okay. So the removal of the ovaries, is that suggested for a patient of any age and pathology of the breast cancer?
Generally in premenopausal patients who are ER/PR positive.
This is Marcy. This is Marcy. Brooke. This is a question for Dr. Mahmoud and possibly David. And a question we get in our office often is, if I call, how quickly can I get an appointment into the new Ellis Roswell Partnership Medical Oncology?
So patients who've just been diagnosed, we strive to get them in within a week. Patients who are coming in for second opinions, it's generally a little bit longer. But for new patients, new diagnoses, it's within 1 or 2 weeks.
Good. Okay.
Marcy, let me make a comment about the second opinions. So when you're diagnosed with cancer, obviously that can completely shatter the earth around you, and one thing that's really important is that it's not only about care coordination, but it's also about having the right experts review all the information that is there. And one of the key pieces to that is pathology. And so this partnership essentially allows patients to have access to some of the world's most subspecialized pathologists in certain disease sites. The pathologists at Ellis Hospital already are top-notch pathologists, and we have now tightly integrated their pathology department with our pathology department. So if there is a question, they'll have immediate access to our pathologists. And the same is true on the radiology front, for instance. So, it's not just about the treatment piece, it's about all the other ancillary pieces that really make or break cancer care for a patient.
Wonderful.
So we have a couple other questions coming in here. What does the gut protection look like? Is it oral? Going back.
So I can address that. So while people are on chemotherapy, the gut protection is really symptom control. So things like protonics, some other PPI, Tums. Also, I'm a big fan of eating yogurt. So a lot of probiotics to get that gut health back into its usual state after the chemotherapy is done.
Caraphate. If it's real bad, caraphate is the caraphate slurry. You take that before every meal and just before you go to sleep. It helps to heal the ulcers that you generally are caused by the chemotherapy.
All right, so now's your last chance to ask this group of knowledgeable physicians your questions. So we have a couple more coming in. One of the last is, we have some grown grandchildren that do not eat hardly any foods high in fiber. What would you suggest as how they should be advised?
I can definitely answer that question because I get it often in practice. So adults, that's worrisome because adults that don't eat high fiber foods, to me, if they have kids, that means their children are not eating high fiber foods. So I think this is a generation problem. So what we do with kids is you sneak it in them. I mean, you can puree broccoli, you can put it in meatloaf, you can puree so many vegetables, sneak it in kids. With adults, I'm not sure. I actually ask them, why don't you like it? What, and it's like, oh, I grew up and it was canned asparagus or canned beans. And it's like, well, did you try fresh? Did you try cooking it different ways? In my cancer journey, we actually had cooking. There were some cooking classes for, you couldn't eat. There were things that you couldn't eat. And so they showed various ways of, what you can do to make the food more palatable. With adults, though, if you really aren't going to eat any fruits or vegetables and increase the fiber, then you should be drinking, whether it's Metamucil, which is a little thicker, that's added fiber, or, there's Citracil, more palatable. There are various drinks out there that are high fiber that will help to at least get the fiber that you need. And one little addition is the fiber doesn't work unless you drink water. You've got to drink your water with your fiber. If you just eat a lot of fiber and you're not drinking water, it's not going to work. You have to drink your water.
I'm going to put my pitch in again for probiotics and yogurt and sauerkraut and kimchi and, that kind of stuff to help restore the gut to